Bismillah ar-Rahman ar-Rahim. Thanks for having me in that meeting. It's my pleasure to present my lecture today with my colleagues. I'll discuss erectile dysfunction in diabetic patient. I am Dr. Ahmed Salah, lecturer of urology and urology at Aswan University. Our outline today, we will discuss introduction, prevalence of erectile dysfunction in diabetic patient, and the pathophysiology and management options, and also the role of continuous low-dose tadalafil in treatment. Erectile dysfunction is a persistent inability to achieve and maintain erection sufficient for satisfactory sexual performance. Global prevalence, erectile dysfunction affecting millions of people, men worldwide, and it is increasing particularly in chronic conditions like diabetes. As we see here, Leonardo da Vinci 500 years ago said, "The penis does not obey the order of its master, who try to erect or shrink it at will. Instead of that, the penis erect freely while its master is asleep. The penis must be said to have its own mind by any stretch of the imagination." So who is the master? The penis is the master. So the prevalence of erectile dysfunction, we will find that 2 to 3 times the patients that have diabetes complaining from erectile dysfunction, and we will find that in type 1 diabetes, 50 to 60% of persons will have the complication of erectile dysfunction after 10 to 15 years of disease. Also in type 2 diabetes, 50% of the person will have erectile dysfunction, and the prevalence increasing with the age and the duration of the diabetes. Many factors affecting the prevalence of erectile dysfunction in diabetic patient, like duration of the diabetes. Longer diabetic duration increasing the high risk of erectile dysfunction. Also glycemic control, poor glycemic control will increase vascular and nerve damage and increase risk of erectile dysfunction. And the patient maybe have other comorbidities like hypertension, hyperlipidemia, and cardiovascular disease. All of that will increase the incidence of erectile dysfunction. Also, in the patient with diabetes, his lifestyle like smoking, obesity, excessive alcohol intake will increase the erectile dysfunction. And if you have any neuropathic or vascular complication, will increase the erectile dysfunction prevalence. So how that diabetes affecting the incidence of erectile dysfunction? There are many factors and key mechanisms that affecting causing erectile dysfunction, like vascular insufficiency and neuropathy, hormonal imbalance, and psychological factor. Vascular pathophysiology, you will find that there is endothelial dysfunction, like chronic hyperglycemia will cause vascular endothelial dysfunction and decrease nitric oxide, which is the main factor inducing promote erection. And also atherosclerosis, high blood glucose accelerates the process of atherosclerosis and leading to narrowing and hardening of the blood vessels. And microvascular disease like diabetic microangiopathy affecting the small blood vessels and which achieve or maintain an erection. Decrease perfusion and oxygen delivery, impair erectile function. Also, there is another factor like neurological pathophysiology. We will find that diabetes affecting diabetic neuropathy, autonomic neuropathy. All of us know that erection depending on parasympathetic and ejaculation on sympathetic. Also, sensory neuropathy, impaired sensation of and erectile response due to nerve damage, and impaired nerve signaling damage to the pelvic nerve, especially the cavernosus nerve, will disrupt the normal release of neurotransmitter like acetylcholine, which is important for erection. Also, loss of erection inducing reflexes like diabetic neuropathy impairs the neurovascular reflexes responding for initiating erection in response to sexual stimulation. Hormonal and metabolic factors, testosterone deficiency, diabetic patient complaining from low testosterone levels, that meaning that low libido and erection. Also, low testosterone exacerbate endothelial dysfunction and reduce erectile response. Insulin resistance and metabolic syndrome contribute to vascular and hormonal disruption and promote erectile dysfunction. also inflammatory and oxidative distress due to diabetes, which further damage the blood vessels and nerve involving in erectile function. Psychological factor is very, very important. This is an important slide. Psychological stress, because the chronic illness and the concern about sexual function often lead to anxiety, depression, and worsening erectile function. So it is very, very important to counseling your patients that you have not a problem. We have a magic treatment, and we'll give you a medication that will help you to marry the second wife. Okay, even his first wife will be happy with this medication. So psychological counseling is very, very important from the first visit. And reduce self-esteem, because diabetes-related complication can lead to negative body image and sense of sexual dysfunction. So counseling is very, very important in your clinic. How to manage patient with erectile dysfunction? It is a multifactorial approach. Erectile dysfunction in diabetic patients require a comprehensive management strategy addressing the underlying causes. Goal of our treatment: improve erectile function, enhancing quality of life, and address contributing factors like poor glycemic control, vascular issue, and psychological factor. There are many treatment options, like we have to start by lifestyle changes, pharmacological therapies, psychological support, and last, surgical options in refractory cases. Lifestyle modification like blood glucose control, weight management, and smoking cessation. And pharmacological treatment is the first line treatment, like phosphodiesterase 5 inhibitor, like sildenafil, tadalafil, vardenafil. And mechanism of action: it inhibits increased cyclic guanosine monophosphate, leading to improved benign blood flow, well tolerated in diabetic patient. Tadalafil 5 mg daily provide spontaneous activity with minimal side effects. You know that the black horse right now, to give the patient continuous medical treatment, tadalafil 5 mg, because it's work for 36 hours, and it gives the patient spontaneous sexual activity, which is mandatory, especially for type 1 diabetes, because all of them is young age, and most of them after 10 to 15 years may be complaining from erectile dysfunction, and he don't need on-demand treatment. He needs something to help him spontaneous and 24-hour sexual activity. Testosterone replacement therapy, all of know that testosterone level will be decreased, so we have to add for him testosterone injection to treat hypogonadism and improve libido, erectile function, and overall well-being. Our second line is intracavernosal injection. Argostadil combination therapy, babaverine and phentolamine, direct injection to the penis. It is an effective, and this respond to it's better than if the patient failed from all the treatment. You have to offer for him intracavernosal injection. Some of the doctors don't offer for his patient intracavernosal injection, although intracavernosal injection is one of the guidelines. This is the second line before to go to the surgical procedure, and you have to take enough time to learn your patient, and maybe in some situation his wife, how he can inject himself intracavernosal, and the dose, how he can inject. And from our experience, there is marvelous improvement with the patient, because it gives him a rigid erection from 15 to 30 minutes. And I think it is better than the surgical procedure. And you have to provide for your patient surgical procedure in case of only refractory patient refusing intracavernosal injection, because it gives the patient the sensation of normal, not I have like a metal or something plastic in my penis. And the second thing, it gives him warmness of the penis, and it is very, very important for psychological support. Benign prosthesis is the last, and as we see here, this is the rod. There is something to this is the rod for the benign prosthesis. This is the right one, and this is the left one. This is one of our patient. He married 4 women. He is from Sudan. he is doing well right now and making dua every day for me because he doing 100% success. So we have two benign processes, inflatable benign processes and malleable benign processes. This patient has malleable benign processes, and success rate, high satisfaction rate from 80 to 90%, and risk factors for this patient: infection, mechanical failure, and device malfunction. The most important complication in diabetic person is infection, so we have to do adequate monitoring for diabetes before offering for him surgery for benign processes. Psychological and behavioral therapy is very, very important, like any of the previous, like medication and intracavernosa injection and surgery, because you have to counseling your patient. Cognitive behavioral therapy can help address psychological factors like depression and anxiety and performance and anxiety. So you have to tell your patient that we have the magic treatment and we help you to pass on this problem, and don't worry about it. And for sex therapy, you have to discuss these issues with the couple. For me, in my clinic, I discuss it separately with the wife and the male patient. And for example, I asking him to go to the toilet because I wanted to measuring his post-micturition residual. And at that moment, I discuss with his wife that I'll prescribe for him a medication. And even if you are not satisfied with the response, don't tell him that it is not satisfied. Tell him that it's okay, it is a magic treatment, you do a good job that moment, and I promise you, maybe we will discuss it later, I will increase for him a medication, or I will shift him for another line of treatment. So it is very, very important to discuss this issue with the man by himself and his wife separately. And for the man himself or the male factor, I'll tell him that, as I mentioned, that we have a magic treatment, we will give you a chance for the second wife, and that's it. Also, we have to treat stress management, because you know the economic situation, and if you have any problem with your life, like your work, all of these stress conditions were affecting your life besides the diabetic situation. We have to treat also other managing comorbidities like cardiovascular disease, hypertension, dyslipidemia, and also obesity. As all of my professors mentioned, weight loss can improve insulin sensitivity and erectile function. Now we will discuss just in brief a rule of continuous low dose tadalafil in treatment. So it is suitable for men who desire spontaneous sexual activity, which is very, very important, without having to plan for medication used before intercourse. So what's the problem facing us in our clinic? That the patient refusing to take something like activation. He needs to take something like a medication, because he feels that it is something like common cold and any other disease. So if I will take a medication, so I will be happy with that. But if you'll discuss something to take on demand before sexual intercourse, he feels like he taking something for activation. So tadalafil 5 milligrams daily dose bust upon this point, and also offer for him continuous spontaneous 24-hour sexual life. So the benefit for that: take once daily, provide continuous therapeutic level for erectile dysfunction, as we mentioned. Tadalafil 5 milligram daily can be more effective, convenient than on-demand use for some diabetic patient, and enhance endothelial function and blood flow. And the effectiveness from 60 to 70% of men with erectile dysfunction, including with diabetes. Minimum side effects, like common side effects including headache, back pain, and indigestion, but generally well tolerated. So the most important one is back pain. So the patient coming to you with back pain and hip and joint pain, so you have to address this complication if it has happened or not, because maybe he feels that it is related to orthopedic surgery and he go to his orthopedic consultation. So you have to follow your patient for the next week and see if this complication happened or not. And you have not to stop the medication, just counseling for him for just some analgesic, and it may be work later on, because 1 week or so on. If it is still persistent, just describe for him another medication rather than tadalafil 5 milligram. So our take-home messages: multifactorial erectile dysfunction treatment is a multifactorial approach, and diabetic patients require comprehensive approaches that include lifestyle changes, pharmacotherapy, and psychological support, which is very, very important. Don't miss it, please, in your clinic, and when needed, surgical option. Rule of tadalafil: continuous low dose tadalafil 5 milligram is a significant advancement in treatment in erectile dysfunction and diabetic patient, offering convenience and improved sexual spontaneity. Collaboration, a multidisciplinary approach involving, we have to involve endocrinologist, urologist, and cardiologist, and psychologist is essential for optimizing outpatient outcome and improving quality of life. Thank you.
شكرا جزيلا دكتور أحمد.